Hello, good evening, everyone. Thank you so much for coming online, for joining us today. So, once again, I'm here for you. I am Patience Oyeme Olaya. I am just teaching. I'm a speech therapist who is busy trying to help parents figure out what's going on with their kids' growth and development. And today I have here with me Mr. Promise Okonkwo. Mr. Promise is a clinical audiologist at Evercare Hospital, Lekki, Lagos. He's a trained audiologist with 10 years of experience in advanced diagnostic, hearing and balance disorders, hearing amplification technologies, assessments, and everything that has to do about hearing. Mr. Promise is a licensed professional with Medical Rehabilitation and Therapist Board of Nigeria, MRTB, and he's also a member of the Speech Pathologists and Audiologists Association of Nigeria, SPAN. His clinical interests include adults, pediatric, advanced diagnostic, excuse me, he's interested in making life better for everyone when it comes to hearing, on how you hear. So, welcome with me, Mr. Promise Okonkwo. Thank you so much for joining us today, Mr. Promise. If let me just let us know that Mr. Promise is not charging us for this service at all. He's doing it free of charge. So we are very, very grateful to you, Mr. Promise. We know if we were to charge us now, I know that you charge us usually because you work in Lekki, for goodness sake. You're a big boy.
It's okay. This is for everybody.
Yeah.
This is for speech even. This is for patients out there. This is for everybody out there. This is just a little way we can give back to the society because we know that a whole lot is happening out there, and patients need us. They need to learn about a lot from us. So any avenue, any way we can offer back to the society, this is just what we have to do, and we just have to do it well. So it's my pleasure to be here today with you.
Thank you so much once again. So, let me just fancy a little bit before we get to the business for the day. I've known Mr. Promise for a very long time. So whenever I say promise, don't take it too personal because
Yeah.
we've come a very long way. I've known him since we were both undergraduates. He was a year my senior. He was my senior in school. And he's one of those good big brothers that we always go to for materials that, please give me this material.
Interesting.
Yeah, he was also one time president in the department. I mean, the association.
Right.
So we've done so much together. He's a big brother in the profession. I can call him chief. Yes, he's my chief in this profession. He's an audiologist. So, Mr. Promise, I hope you are ready for us today. I know you are always ready.
Well, we'll do our best. The most important thing is that we give the best to people listening because it is in what we can give to them, they will be able to make good and informed decisions with whatever they learn from here today. And I'm also sure that we can also learn from them because we learn from people we speak to, we learn from our patients, we learn from their history, we learn from their stories. So we are all here to learn. That's the most important thing.
Yes, right. So let's just go straight to the business for today. I have listed out some questions that I'll be asking Mr. Promise on our behalf. And if at the end of everything, I haven't captured your question, you can do that in the comment box. I will read them out to Mr. Promise, and will respond to every of our questions. So I have here 11 questions asked Mr. Promise, and I hope he'll be able to respond to all our questions in a short time. So the number one question, we always preach about early intervention, because we know that when an assessment is done early in life and the diagnosis is made and treatment starts immediately, we know there is a greater chance that such a child will benefit from the intervention and do well. So I want to ask, what should parents of infants watch out for when it comes to recognizing the onset of hearing loss? What are the signs that a child might be having hearing disorder at an early age, as young as an infant? Thank you.
Okay, thank you for that question. That's a very good question, because like I will always say to my patients, most especially the young, I like using patient because I work with patients a lot. So people should not mind me when I say patients. You might not be my patient, but at least let me say client or a listener. Now, I always tell them that mothers are the first doctor of every child. Mothers are the first doctor. Mothers are superhero. They are everything. They are the doctor, they are the cleaner, they are the mother, they are the cook, they are whatever, they are everything. So, like I always tell them when I see them in the clinic, you are the first doctor of your child. Even what doctors don't know, you make us understand, you make us learn, you make us know. So, there are things that you need to watch out. And when you watch out from your own basic instinct and you feel that something is not right, it is always good to speak to your doctor. I've had experiences where patients say, yes, I noticed this a year ago, but my mother-in-law, my father-in-law said, no, it doesn't matter, just let the child be. No, please, it matters. When you notice that something is off, it is always good to speak to your doctor. And some of the things that you will need to notice as regards your child hearing is that as child grows up, there's one thing we call milestones. There are certain things they should be able to do at a particular time, at a particular age. Let's take for an instance, a 3-month-old baby. No matter how small the baby is, there are some reactions you will see on their face when you're playing with them. Or when you bang the door, they should react. Or when you say something, they should react. I will give you a short story about myself. My mom usually say that I am quite quiet, very quiet when she had me in, when she had me, when she's crying me in her tummy. She usually go to the doctor, and when the doctor says to her, Madam, see, once you feel that your baby is not moving, just speak to him, ask him that, baby, are you there? Call his name. And my mom went back home, and when I became so silent, I wasn't moving enough. She told me this story. She said to me, Ebuka, that's my Igbo name. Are you there? And, I shake my body within my mother's tummy. And she was happy. She was happy that, wow. So even right from birth, children, babies, they can hear. We communicate with them. You understand? So once you put to bed and your baby is not responding to you in the way you think they should respond, like you bang the door, they are not reacting, like you shout and they are not startled, then you should know that there is a need for you to check. There's issue somewhere. So these are the little things. At 3 months, your baby should be able to start trying to, follow you with their eyeballs. When you move around, they follow you. When they hear sounds, they look towards that side. It might not be completely, but at least with the reaction of their face, you will notice that your baby can react. When they're like maybe 6 months, they should begin to start trying to pronounce some jargons. Maybe looking at it, all these things, they mean a lot. Because when they hear, when they're receiving sounds, they try to say the same thing. It might not be right. It might just be giving out some funny sound. It might be papa papa. It might be all these things really matter. If your child is
That's
not doing that, then you should know that there is something to be worried about and you need to see your doctor. And it's very good that we catch them as early as we can, because once you can catch them as early as possible, then you will be able to help them out in terms of early intervention, in terms of the procedures or therapy that you need to do for them. And this is for those child that have concerns. And they're also the part of screening. As early as possible, when you put to bed, even if your doctor is not saying anything about it, please ask. There's what we call hearing screening. You can check a child's hearing as maybe a 1-week-old baby. You can screen them and know if they are hearing or not. It's a very seamless test, painless. Your child don't need to do anything. We just put a probe in their ear and you run the test, and the result will come out. It doesn't take less than 3 minutes. The result is out, and they will be able to tell you if your child can hear well or not. Okay? So please, mothers, you are your child first doctor. Thank you.
Okay. Thank you very much. So, as at anytime around 6 months, if a child is unable to babble, to make sounds, follow direction of sounds, like maybe when the door is slammed, like you said, and the child does not, that should be an indication that something might be wrong with the child's hearing, and the mother should do an assessment.
Definitely. Yeah, so, definitely. That is an indication.
And I'm really glad that I'm a mother. I'm my child's first doctor.
Yeah, that's it.
So the second question. Yeah, I understand that some cases of hearing loss starts when the child is in the womb. That's what we usually call prenatal deafness or prenatal hearing loss. So what do you have to say about this, especially for those who are planning on getting married or who are pregnant at the moment? How can they prevent hearing loss in their children?
Okay, thank you very much. That is a very good question, because most of this happens, like you said, prenatal, before birth. You cannot know, but there are ways you can actually prevent them. Now, for instance, mothers are advised not to take alcohol when they are pregnant. Mothers are advised not to take alcohol. This can actually impact your child's hearing. It can impact any other part of the body, which hearing is inclusive. Then again, genetic counseling. It is good that you go for genetic counseling. We don't do much of that in this part of the world, but it is quite important. I think the bulk of the kind of test we do is the sickle cell assessment test, or what we call genotype test. Maybe a father has a trace of sickle cell in their blood. This is what we do. I'm sure that people don't do much of that too. There is still a lot of advocacy going on that, but I think largely, as compared to genetic counseling, people know about that. But genetic counseling too, once a father, a man and a woman, their genetics, if it doesn't work together, if their chromosomes do not work together, all these things can actually affect a child too in terms of hearing. So it is good and it's advisable that while you're going for all your necessary tests, you do genetic counseling too. Then again, infection. Mothers should be very careful when it comes to hygiene. They need to really take care of themselves, because this will affect their children. Fathers too, because I know that while a mother is pregnant, fathers too, enjoy themselves with the mothers. So you can infect your wife. And once your wife is infected and it is not well treated, this can affect the baby in the womb. Then there are also unknown causes. You can't tell maybe whatever it is that happened. We call it unknown causes because we can't know everything. Research has been going on, trying to know what could cause this, what could cause hearing before a child is put to bed. or before a child is delivered. Then we also talk about generally feeding. When if you don't eat good food, if you don't take good care of yourself while you're pregnant, this can affect your child's hearing too. I want to believe that a lot of mothers, this information they get while they go for their antenatal. So all this really, really matter before while you're pregnant. All these are quite important. So, but most important, I think genetic counseling, infection, all this needs to be taken care of, because if those are not taken care of, it is bound to affect the child. Smoking too. Mothers are advised not to smoke. All these things affect the children. And then also stop consuming drugs. Self-medications are not good for you as a mother, because if you're taking medication, if you are taking, there are some medications that are not good for mothers. I'm sure we're still going to get to that part. Antibiotics, they affect children, they affect mothers, and if you just feel, oh, today I'm not feeling too fine, you can just consume any drug that comes by you, maybe, or you're feeling some kind of funny body temperature. Instead of you seeing your doctor, you decide to self-medicate. Self-medication is dangerous. So mothers are advised not to self-medicate. These are the things that affect children in the womb. And part of what it can affect is their hearing. So I think we can leave it at that.
Okay, so for pregnant women, we are advising them to stay off unprescribed drugs, to stay off alcohol, smoking, and for the men, they should not become they should not become they should not infect their wives during pregnancy.
They need to treat themselves, because if they feel they have a kind of infection on them, they really need to treat themselves, because they can infect their wife. The reason why I'm talking about men, so that this doesn't look like it's all about the women alone. Men too are involved. Men too are involved. You understand? Men too are involved. They really need to take care of themselves, and in taking care of themselves, they are taking care of their wives too by proxy. Because if you don't take care of your wife, if you don't take care of yourself, and you don't know that you're carrying infection, and you go, in with your wife, lay with your wife, you sleep with your wife, then you can infect her, which will also affect the baby if it's not well taken care of. So this is not about the woman alone. Men too are involved, and they have to take responsibilities too.
Thank you very much. So speaking about infections, there is this infection that is quite common, otitis media. Sometimes otitis media with effusion. That's when whitish or creamy discharge starts coming out of the child's ear. I've heard about this a lot, that it is stubborn, difficult to treat, and that it usually causes hearing loss when it is not properly handled. Please, can you enlighten us more about otitis media or otitis media with effusion, so that mothers and parents listening, if they have children who are already infected, they will know how to go about it, the right thing to do, so as not to lose the child's hearing due to otitis media? Thank you.
Okay, I'm not surprised that this question is coming up. Otitis media is a very common kind of infection among children. Well, by definition, otitis simply means inflammation. So otitis is that inflammation of the ear, swelling of the ear, redness of the ear. So and when we say otitis media, we have media simply just mean the middle ear, because we have otitis external, we have otitis internal, and we have otitis media. So the media is quite common among small children. Now, why is this very common among them? When children are growing up, their ear canal is quite tiny. That's one. And also their eustachian tube. Eustachian tube is a tube that connects from there's a connection between the ear, the nose, and the back of the throat through the eustachian tube.
Okay.
And it's also quite tiny because they are still young. So this, in most cases, could cause an infection in the child. Otitis media, by explanation now, affects children because there can be flow of fluid from the nose back to the throat or to the ear. Normally, the eustachian tube regulates the pressure between the inner ear and the outer part of the ear. But once this eustachian tube is not functioning very well, it could cause retention of fluid in the inner ear. So once this fluid is retained and there is no way for it to flow out, then it could cause infection. Then again, like I said, otitis is inflammation. When there is an inflammation in the ear, that also could cause the fluid not to be able to flow the way it should flow. So once this is happening, then a retained fluid in the inner ear will definitely can get infected and it will affect the ear. So but most times the doctors treat this by antibiotics. But you mentioned the other time that it's quite stubborn. Yes, it's quite stubborn. It could happen now, then reoccur again over time. But the most important thing is that it will get sorted out as time goes on. But it is important that once such occurrences happen, the children need to see the doctor. Because once they see the doctor, medications are prescribed and the children can do well. And again, most times this happens during the cold season, during maybe a Matan or during the cold weather. This is actually the time that happens. But mothers should not be allayed. They should not be scared about it once their children are experiencing such. But the most important thing is that they should see their doctor. Once they see their doctor, the necessary steps will be taken to take care of that. But it is more common among children, and most children will experience it while they are growing up. So that is about otitis.
Okay. So when they see the doctor and they are given antibiotics to use, they should also use it religiously.
Yes, it is important. Don't use half and say the child is fine, I'm not going to use it anymore. No, those medications are given and they are prescribed accordingly for reason. So if a medication is prescribed for you or for your child for 5 days, don't say after 2 days, because my child is fine, I will stop using it. No, you need to complete the medication. If a medication is prescribed for 1 week, please use it for complete 1 week. By doing that, you will get a good result. But if you use it, then you feel the child is fine and you stop, then you are not helping the child.
Wow. Thank you very much.
Sorry, like I said, mothers should not be allayed, parents should not be scared. It happens to most children. It's quite common among them because they have a very tiny air canal and eustachian tube, and this can occur anytime.
Okay, thank you very much. So parents, did you hear that? Do not be afraid. Otitis media or otitis media with effusion happens to children a lot because of their very narrow ear canal, right?
Yeah. And the effusion you spoke about is just the fluid that comes out from their ear.
The discharge, right? The fluid.
Yeah,
okay.
Yes.
Okay. Thank you very much. So speaking of antibiotics, medication and all that, my next question revolves around this. I did a study a few years back on aminoglycosides. That's a class of antibiotics. How aminoglycosides affect the hearing acuity of people. So I would like you to talk about this. So I know that medications like kanamycin, amikacin, they are aminoglycosides, and
all the same family.
Yes. So you don't have to talk about just amikacin and kanamycin. Just talk about tell us about general ototoxic medications, and how they affect the hearing of children, adults.
Okay, thank you. You've said the right word, which is ototoxic medications. Like you said, in most cases, when they are misused, fine. Saying this doesn't mean that some of these medications are not meant to be used. They're actually meant to be used. But like we all say that anything that is misused, then it becomes a problem. Even the water that we drink, when you take too much of water, it becomes a problem. When you take too much of food, it becomes a problem. So there are some medications like that, so that we are not encouraged to abuse. If no medication is encouraged to abuse, but there are some medication that you are not supposed to abuse them. If you abuse them, then you will get significant effect of them. Some of them are there are some antibiotics like that. They affect that is what we call the air cells. The air cells is just like the air of that's why they call it air cells, just like the air. Yeah. We have them seated in the inner part of our ear. When you take some of these medications, what they do is that they eat off the air cells gradually.
Wow.
And once that is happening, then hearing becomes an issue. Hearing loss begins to set in. So many of these medications are quite dangerous. Like the post I made today, I was talking about the story of a man that the child was given um, antibiotic, I think chloroquine medication or so. I think it was in excess. I didn't know what happened. I didn't understand what actually happened. I didn't question too far. But based on the history the father gave me, he came from another state to see me in Lagos. So based on the story he gave me, he said the child was given some couple of medication, and they gave him the medication and also was given injection, and that affected his hearing. The hearing deteriorated. I think the boy was about 4 years or 5 years thereabouts, and the father felt so bad about it. Understand? The hearing of the child deteriorated. These are instances of ototoxic medications. And once these medications are not used rightly, once they are abused, then the effects can be that significant. Some people are lucky, actually. Some people can be lucky. It will not happen. The body system is built in such a way that what your body can absorb, my body might not be able to absorb it. So the most important thing is that we should learn to use medication rightly and not consume medication when we are supposed to see our doctor for the right prescription and the right direction. Self-medication is quite dangerous, and one of the effects is hearing loss, and it can affect its hearing. I hope I'm able to answer your question.
Yes, thank you very much. And I'd like to add to what you said. Aside self-medication and I feel parents should be very careful when it comes to addressing their children's ailments. I know things are hard, I know things are difficult, but make sure whenever your child is ill, the medical professional attending to your child is licensed, is qualified to do the job they do.
I was going to say that, yeah.
Let's stop this backdoor consultation. Let's try as much as possible to go to health center. If you cannot afford a private one, go to the government one available within your reach. Instead of calling doctors on the phone and telling the doctor my child is ill, you may not get the best, and also you may misunderstand whatever the doctor tells you on the phone or through chats. You may not get the best from that. And also, let's stop this habit of going over the counter to get whatever we want, because you can get it in Nigeria. Any drug you want without a prescription, you can just go to the chemist and tell the pharmacist, my child has a headache, give me something, and the pharmacist will give you whatever they want. Pharmacists are trained to dispense medication based on the doctor's prescription, not to not to give prescriptions. So I feel it's dangerous. Let's not endanger our children's lives or their hearing or their well-being because we want cheaper way. We want cheaper ways out of our issues. Okay, that being said, we'll move on to the next question now. So now we are in this era in life where everyone has an AirPod. I have mine. It's a gift from my husband. So everyone has an AirPod or headsets, earphones.
Okay.
We use them to listen to music because the music hits differently when you use your headset, right? Because everything is just perfect when you are listening through your headset. And sometimes parents go because they are affluent, they have money, they can afford it. They buy phones, iPads, iPods, and the likes for their children. They get them headsets. And we know research states that overexposure to loud sound, to noise, can lead to hearing loss. So, what advice do you have to us, not just the children now, to the parents, to us in general, as regards the use of headsets?
Headset, phones, and okay. Well, that's a very good question because we are in the generation of technology, and a whole lot is happening out there. New things, new tech are coming out every day. Even if you don't want to use it, you'll be tempted to use it. But the truth is, they are quite dangerous to our hearing, specifically. The just like the illustration I give the other time, these are we call noise-induced hearing loss. They could cause hearing loss, and you would not know. That is the painful part of it. Now, before I give advice on what needs to be done, I will give an insight on the danger in all this. Using headsets, using earphone, using earpiece, all this all together are good when you're listening to music. Okay, you want to enjoy the music, you want to get the perfect sound. When I speak to people, they'll say, how do I get the bass line, the all this, it needs to come out, the birds needs to come. I said, okay, fine. They need to come out, but as well as you can listen with that, you can also listen without it. All you need to do is train yourself to listen. A lot of people don't understand how to listen. People just want to, they just want to hear the sound as loud as it is. You don't have to hear the sound loud before you can enjoy music. Now, what the danger is that once you're using those headsets, they affect your eardrum, they affect your inner ears. And this will not give you signs. Most people don't know how to use this because they raise the volume so high. And what you're doing to yourself is that gradually it's affecting your hearing. You might not notice immediately. It might not be now. The effect and the impact might actually be after 10 years, or after 15 years, or after 20 years. But it's gradual. We call hearing loss a silent killer. Not because it will put a gun to your head, but because it kills the ear, it kills your hearing silently. You will not know. You will not notice. And the brain is so smart and the brain is so interesting and amazing because the brain helps you to adapt. Let me give you an example. If a generator set is turned on here, what will be your first reaction? Your first reaction will be that, oh, come on, this noise. And before you know it, you adapt. You realize that you just cope. To you, you feel, okay, my hearing has adapted to it. That is your brain helping you to adapt to the noise in your environment. It's not your ear. The ear is just a channel to the brain. The brain does the interpretation and everything. So once you adapt and you feel, okay, you're good, you continue. Then once the generator goes off, how do you feel? You feel like, oh, come on. Is this the noise I've been exposing my ears to all the while? That is what the brain does for you. Your brain helps you to adapt. But your hearing, your ear organ will not adapt. But
True.
it is being affected. Do you understand? So the same thing with the AirPod and earpiece. When you put it on too loud, you will enjoy the music at that moment. You keep enjoying it for as long as you're using it for years, you continue to use it. But your hearing system is being affected gradually. So in the next 10 years, the next 15 years, the next 20 years, it will get to a significant point that your hearing will not be able to handle, your auditory system will not be able to handle the sound stimulation that you need anymore. Then it becomes significant for you that there's a problem somewhere. So that is how.
Yeah, I think we lost Mr. Promise.
Significant. Hello?
Yeah, your network went off, tripped off.
Okay. Am I back now?
I can hear you. Yes.
Okay, that's fine. So, like I was saying, it is important that when you're listening, when you're using those devices, naturally, what I do advise people is that don't use them. But if you have to, please turn down the volume. If you notice, most phones now comes with this caution. Will tell you if you're going beyond this level, then it is dangerous. So you really need to understand that those cautions are meant to guide you against going beyond the recommended level. There's a particular level you shouldn't go above, considering other factors too. Once you go above those levels, then you are endangering your hearing system, and that will not be noticeable immediately, but over the years, it becomes noticeable. Don't be surprised that after like 15 years or 20 years and you begin to have hearing concerns, then you will start wondering that, but last year I could hear very well. Yes, last year you could hear well, but you've crossed the threshold. And the moment you cross the threshold, then it becomes significant. And at that point, you can go back. So it's advisable, if you have to use it, listen very low.
Okay, thank you very much. So Mr. Promise says, use it moderately. Do not exceed the limits. Do not tune your music too high. Reduce it and use moderately. And also, he said we should minimize the way we have noise pollution, because the way it affects the ear, it affects the hair cell in the inner ear. And when the hair cells, they get destroyed, it is irreversible, right? Yeah. And when the hair cells get destroyed, it affects the hearing. So I have a question from Mr. Onas, Isaiah Onosoya. He's asking about the contribution of pharmacists. He didn't get quite understand. Okay, I hope I'm not being misunderstood. I am saying that parents should always seek medical advice when their words are ill, instead of going over the counter to get prescription from the pharmacist. Because the truth of the matter is, not everyone you see in a pharmacy is a licensed pharmacist. Some of them are sales rep. They are not pharmacists. So even if the pharmacist has the knowledge of which medication, which dosage should be given a child, it's not in all cases that the parents will meet a qualified and licensed pharmacist. Medication. So it's always best to go with a prescription and get it from a reliable source, not just going to the pharmacist, because some pharmacists, they call them chemists in our areas. Yes, they call them chemists. They'll just say, I'll go to the chemist now, let that person give you medication. I've seen on social media certificates being given to someone after training for 3 years. They graduate. When the real pharmacists will go to school for like 6 years, do internship and all that before they are licensed to practice, someone will just train or sit down. someone for 3 years and say they are licensed to prescribe. No. So let's be very, very careful. I am not saying pharmacists are not, I don't even know the purview. I mean, what pharmacists, I don't know everything they are licensed to carry out. But then you as a parent, it's your responsibility to make sure where you get your drugs from, they are the legitimate business, I mean pharmaceutical companies or outfits. And also ensure that you get a doctor's prescription before you go ahead to get the medication, in case that person is not qualified to make that decision for you. Always get a doctor's report, a doctor's prescription before you buy that medicine for your child, and follow through with the dosage. Be very careful with that. Okay, someone is asking, Mr. Edgar was asking dosage. Be very careful with Sorry. That. Okay, someone is asking, Mr. Sorry for the feedback. Edgar was asking. I need to stop this. Okay, yeah, I got that. So someone was asking the causes of hearing loss. Well, it's the causes we've been discussing. So maybe you follow through till the end before you know all the causes.
From all that we're saying, you don't really get the causes.
Yes, yes. We've talked about noise being a cause, infections, we've talked about the prenatal causes, we've talked about different things, and we are still touching different areas. Thank you, Mr. Promise. So now our sixth question: what are the hearing tests or assessments available to us in Nigeria?
Okay, we have quite a number of them, and the tests available, we can see it from the angle of children. I'll say pediatric test for children. We have what we call the autoacoustic emission test, which by abbreviation we call it OAE. That was the test I explained initially. This is a very simple test. You can just, the child does not need to respond to anything, and the child as young as 1 week old baby can have such a test done. Understand? Then we have the other one we call the pure tone audiometry test. This one is mostly for adults and young children. So long that child is able to take instruction and respond, that's another test. We have also what we call tympanometry. Tympanometry just analyzes the middle ear. So we have a couple of these tests. We have up to like 7 tests. We call 7 batteries of tests that can be done for both children, for both young children, for both adults, and for both old and the elderly. So they are available in Nigeria, and these tests are quite objective and very good to discern if a person is having a hearing loss. So we have them. We can always walk into most of the facilities we have in Nigeria now, the government facilities, they do have them. And for the ones that do not have them, they can always refer you to private organizations where you can have it done. So we have them in Nigeria.
So if someone wants to run a hearing test now, they should go to a government hospital, like a teaching hospital?
Yes, a teaching hospital.
What department?
The ENT department or audiology department.
Okay. So ENT in some places is ORL. That's otorhinolaryngology.
That one is a big word for themselves. ENT is just okay. When you say
in Osun State, it is ORL. I did practice there. I'm saying that because in some places they will call it ORL department, while in most places they will call it ENT department. So whichever the case may be in the teaching hospital.
I'm just looking at that long word, otorhinolaryngology.
Also, hearing, yeah, we know that, but we have to tell them so they don't go and keep looking for ENT when there's no ENT in the facility closest to them.
That's interesting. Yeah. That's good.
Okay, so thank you very much, Mr. Promise, for staying with us. And our next question will be on hearing aids. So, what are the assistive listening devices available, and how reliable are the cheap and disposable ones? I know you did a post last week or 2 weeks ago concerning cheap disposable hearing aids. What do you have to say about these cheap ones, and what's the price range, so that parents will know how to create budgets for things like this?
Okay. In the like I always say, I don't pray that people experience hearing loss. Excuse me. I don't pray that your children or any of your family member experience hearing loss, because it can be a traumatic experience for anyone. Now, but in the case that such happened, the best that could be done is to advise that the child or whoever needs it use a hearing aid. We call it hearing amplification. This helps them to hear better. So to differentiate from the popular one or the common one that a lot of people send me pictures asking me that, is this a hearing aid? It is not a hearing aid. Fine. Ads on social media can tell you this are hearing aids, or they can call it hearing aid because it also aids hearing. It helps you to hear better. But most times they are not hearing aid. They just use the word hearing aid just so you can get confused. Now they are basically, I just call them what do I call them? Um, I just call them sound aids. They just help you to hear. It's just like normal earpiece or all these headsets. That's number one. Most times they are quite cheap. You can get them for 5,000, you can get them for 6,000, you can get them for 10,000, depending on the type you want. But they are designed to look like a hearing aid. They are not hearing aid. Don't make a mistake to go buy it because it's cheap. You will be wasting your money. Most times it is for people with good hearing, just so they want to hear better, they want an enhanced auditory stimulation, or they want to watch a cinema, or they want to watch a movie, they can use that. But hearing aids are quite pricey, unfortunately. They are quite pricey. The cheapest of hearing aid that you can get for someone with hearing loss, is about hundreds of thousands. Understand? Hundreds of thousands. As you know, 300,000, 200,000, depending on the type you're buying. Hearing aid is quite pricey, that's the honest truth. But I can assure you that you will benefit. I'm saying for those with hearing loss, and these are programmables. They can program them according to your loss. Now, for the one I explained initially, which is just sound amplification devices, you cannot program them. Both loud, low, and mid frequency, they will just increase everything. It becomes even a problem. For someone with hearing loss, if you use such a device, it will cause you to have problem. It will cause your hearing loss to degenerate because everything is just going to be loud. It becomes a problem for you. The hearing aid are the important one. They are the good one you can use. They are digital, they are programmable. Where you need to hear, you will hear. Where you don't need to hear, you don't hear. They can adapt to your environment. They can do a whole lot depending on the one you're buying. But the truth is, they are quite expensive. We all know what is happening in Nigeria. Dollar is not smiling. These are not produced locally. They are, they are devices from other countries. And before they get here, it becomes quite expensive. So, but I can bet you it is an investment that you will not regret. Once you get a hearing aid, you will be happy you did. So that's about that. Are you still with me, patient? Can you hear me?
Yes, I can hear you. Thank you very much. Thank you very much. So we go to the next question. So, this question number 8. What can you tell us about auditory processing disorder? I work with children who have autism spectrum disorder, and sometimes they have auditory processing disorder. Please, can you shed more light on auditory processing disorder, also known as APD, so that parents who have children with autism will be able to understand better and know what to do?
Okay, the auditory processing disorder is quite, how do I put it? It's quite complicated, understand? And there has been a lot of misdiagnosis. So I will try to be as simple as possible, understand?
Okay.
Now, there are a whole lot that looks like auditory processing disorder, but they're actually not. Now, auditory processing disorder, it's simply how the brain uses auditory stimulation, how the brain uses sound. Now, what I'm trying to say is that when you hear, just like I said the other time, that the ear is just a channel to send sound to the brain. Now, in most cases, children with auditory processing disorder, they hear quite well. They hear very well. If you want a test, to you, you might think there's a problem somewhere, which is in the brain. To you, when an assessment is done and the child test results is being reviewed, you might say, oh, my child is fine. So what is the problem? The problem is not the hearing system. The hearing system is quite okay. But when it comes to the brain area that is responsible for sound understanding, speech processing, then there may be a concern. That is why we call it auditory processing disorder. Now, this should not be confused with children with autism. An autistic child, from one of their characteristics, they can hear you, but they might not also be able to process sound. They might not understand what you're saying. That is as a result of auditory autism. Don't mix it up with auditory processing disorder.
Okay.
That's the higher order. Now, the other part of it, learning disability too, could also cause a child to have issue when it comes to understanding language and speech. That shouldn't also be mixed up with auditory processing disorder. Now, some symptoms of auditory processing disorder is when children find it difficult to discriminate minute differences. You can say cats, they might hear something else. Understand? It's become so difficult for them to discriminate speech sounds that sound similar. Even also, when it comes to the aspect of background noise, when you're talking to them in a background noise settings, maybe there is an interfering sound from the background, they might find it difficult to be able to discriminate sound. So many of these are, pointers to understand that a child might be having APD, auditory processing disorder. Understand? So there are a lot that is going on in terms of research, in terms of understanding, having an in-depth understanding about auditory processing disorder, because there are a lot of issues, a lot of symptoms surrounding that seems like auditory processing disorder, but they are actually not auditory processing disorder. So it takes a lot. Even when it comes to assessment, a single professional cannot reach a conclusion. A lot have to come to play. A speech therapist have to come to play, a psychologist have to come to play, an audiologist have to come to play, a neurologist will also have to come to play. they all have to have a review and sit together and be able to say, okay, from this result, from our review, this is what we can say about this. So,
Okay.
but like I said, there's still a lot of research going on this as regards auditory processing disorder, because there has been a whole lot of misdiagnosis in that aspect. So I hope I didn't complicate things too much. I hope
no, at all. At all. So you can follow Mr. Promise. I just put up his handles. You can follow him. He's at Promise Care on Facebook, Twitter, and Instagram. Then on LinkedIn, you'll find him as Promise Okonkwo. Promise Okonkwo on LinkedIn. So, yeah, let's move on to the next question. That's question number 10. We are gradually rounding up. Question number 10, what about tympanic membrane rupture, also known as eardrum tear? What are the causes of eardrum tear? How does it affect one's ability to hear? And if there is someone whose child has tympanic membrane rupture here, what do they do next? How can it be prevented? So tell us about tympanic membrane rupture, eardrum tear.
Okay, just like you say, it's simply eardrum tears. You know, a rupture in the eardrum. The eardrum is located in the ear, and it's in between the outer ear and the middle ear. Now, it's a thin membrane, a very thin membrane, thin transparent membrane. The rupture can happen anytime. Now, there are a lot of things that can cause the rupture. It can be infection. Otitis media that we discussed earlier too can cause eardrum rupture. Blow to the head. When I say blow to the head, parents that is used to slapping their children, before you know it, our African mothers, I know that they are experts in giving such slaps. When your child does something wrong, the next thing you slap them. This could cause them to have tear in their eardrum. An eardrum serves a very important role in the ear. They transmit sound from, they receive sound, and the vibration sends sound through other mechanism in the ear to the brain. So when there is a tear in the tympanic membrane, that's the eardrum, then the ability for the eardrum to transmit sound is reduced, is affected. It's just like when you have like a drum set. When there is a hole in that drum set and you try to beat it, the sound will come out differently. When you have a good drum set, a well-fixed drum set, when you beat it, the sound will come out well. So a tympanic membrane will affect transmission of sound into the ear. So parents are advised to stop hitting their children on the edge by the ear. And a child could also fall and hit their head. That could also affect the eardrum. Infection too can affect the eardrum. Loud sounds, like bomb blast and a whole lot of, it's quite unfortunate that Nigeria is so insecure these days, and such too can also. Then, cotton buds. Stop poking your ears with cotton buds. They are not good. If you poke your ears with cotton buds, it can puncture the eardrum. And once it punctures the eardrum, be ready to spend money. You understand? The wax you are cleaning out of the ear are okay. They are good. They are meant to be ear. They are serving a purpose. They are preventing your ears from infection, they are lubricating your ear. They are serving a whole lot of function. It's just like when you have saliva in your mouth, you have earwax in your ear. I can't remember the last time I cleaned my ear. So stop putting stop putting cotton balls in your ear. They can poke the eardrum. So back to the eardrum now. Now, when such happens, naturally, eardrums, depending on the size of the tear, eardrums heals naturally. They heal back naturally. But for the ones that are quite big and they cannot heal on their own, surgical procedures needs to be done to fix them. You understand? In the place of pains and earache, see your doctor, they give you medication, and you'll be fine. If the tear is not too much, they will heal naturally. But if too much, then surgical procedures need to be done. So I think that's about tympanic membrane. Just like you said, tear in the eardrum.
Thank you very much, Mr. Promise.
You're
Okay.
welcome.
Now, like you said, for emphasis sake, the size of the tear, the rupture on the tympanic membrane or eardrum will determine what will be done. If the tear is little, it
naturally
may
can
heal on
heal itself.
Yeah. If the rupture is big or large, there might be need for a surgical procedure, also known as tympanoplasty.
Yeah.
Yeah, so that might be the solution to such. And also, I like the way you described the drum analogy you made of if a drum is torn, if the part where you beat on a drum is torn, the sound, when you beat on such a drum, the sound will not come out well.
That's all.
Yes, the sound will not come out well. You will not enjoy the beauty of listening to a drum being beaten. So if there is a rupture in the tympanic membrane, that is the eardrum, it will affect a person's hearing. So, and also, you also mentioned that parents should go low on slapping their children in order not to rupture the eardrum. And I think also teachers too, if they are listening to this or watching, because sometimes I know children can be very, very, very annoying sometimes. But you have to restrain yourself. You have to be cautious. You have to be careful the way you discipline and handle them so that you do not put a lifelong or a life-lasting injury on them. They will always remember, the child will always remember that teacher so or my mother slapped me one day and I lost my ability to hear properly on this ear or on that ear. Which brings me to a question being asked by one of us, Omotayo. She's saying that she stopped hearing, or she doesn't hear with her left or right ear. I can't remember now. And since for a very long time, and she's asking what to be done. I believe she should go for an assessment. She should go and do a hearing test to know what the situation of things, what is going on exactly in that ear. She should run a test to find out. And after finding out, that's when she will know what to do next concerning it. Okay.
Yeah, that's right.
Yeah. So for questions are coming in. For questions we do not address here, don't worry, Mr. Promise is here with us, and he would respond. He will reply to every question on Facebook, and he will respond to every question that we do not respond to here, because our time is fast spent. We've spent over an hour already, and we don't want to delay us further. So the last question, what are the practices or habits that can lead to hearing loss? What are the things you do as parents or as individuals that can lead to hearing loss? What should we avoid? What should we run away from so as to prevent our children ending up losing their hearing ability?
Okay, thank you very much. I will start from the common one, which is Q-tip. Q-tip is cotton balls. You see a lot of parents, they have a big cotton board, box of cotton boards in their home. What you're doing when you're cleaning your air, you are just troubling your air. You're troubling your air canal. You're pushing the airwax further into the air. People have a misunderstanding that the wax in their air is dirt. They are not dirt. They protect your air from infection. They lubricate your air. And some people will say, oh, yes, my ears is always itching me. That's why I have to clean them. No, your ears are not always itching you. They are always itching you because you are cleaning the wax. If the wax is there and your ear is well lubricated, then you won't experience those itching. Let me give you a simple analogy. When you wash your hands and you wash your body, or you take your bath during Harmattan, how do your body feel? Without rubbing any body ointment, your body feel dry. You feel funny. But the moment you rub ointment, you rub oil, your body cream, your body feels so refreshed and well lubricated. That's the way it works in there. The wax are meant to lubricate your ears. But if you keep poking it with cotton buds, then you are keeping it too dry. And once it is too dry, then it will always itch. So also, if I'm going to wash out wax in anybody's ear, I will use headlamp, I'll use my eye, and I'll have to use torchlight. I'm saying torchlight, we call it otoscope, with a light on it, to see through very well before I can bring out the wax. That's if it is excessive, because once it is too much, so it can block the air. If it's too much, yes, we can. If it's too much, it can be taken out. We need to watch before we can do that. Talk aside you can't see your ear and you're putting cotton bud. You're pushing it further. You think you're bringing it out. You're not bringing anything out. You might even see some. I've cleaned my hair. No, you're only pushing it further. So, and that could cause you some pains in your ear. It could cause you some loss. It could expose your ear to infection. That's one. I spoke about headsets, listening devices that you use. When you're listening to them, don't listen through eye. That's if you must use it. If you must use it. I would advise that people don't use them, but if you must use them, maybe because of privacy or you want to listen to some music so that you can hear well, listen low. Don't increase it too loud. Then again, don't expose your ears to loud noise. People love parties. People go to Owambe. People go to church. Stop sitting close to the speaker. I remember going to a party many years back. I didn't enjoy that party at all. The noise was too much. I ran out. Because one thing we don't understand is that any place you find yourself and you are trying to speak to the next person beside you and you have to raise your voice, Uncle, can you hear me? I'm talking to you. That means the noise level is too much. And that is very dangerous for the ear. So also stop using medications that are not prescribed. They are dangerous for your health. Generally, they are dangerous for your hearing. Understand? If you find yourself in a working environment like engineers, construction workers, and your job exposes you to loud noise, you need to start using earplugs. Earplugs will help you to hear, but will restrict excessive sounds. If you go to party, if you have to go to, because if I have to go for a wedding program and I know it is important, I go with my earplugs. I just plug my ear. People look at me that, what's wrong with this one? But they don't understand. I can still enjoy the same music they are enjoying it, but in a reduced level. Understand? So these are many more are the things that it's important that we do. We call it hearing conservation. You're conserving your hearing so that when you get old, when you're 50, when you're 60, when you're 70, when you're 80, you're still enjoying the sound of life. You're still, by that time, you have your own omomo, you have your own grandchildren. You can still listen to them, call you papa, mama. You still have your hearing. It can be very painful. I see patients come here. They say, Grandpa cannot hear us anymore. I don't know what's going on. He can't hear us. And Grandpa will be saying, what do you say? What do you say? It's, it can be annoying. It can be painful. You understand? If you want to get to that stage of your life where you can still enjoy the voice of your children and your grandchildren, enjoy social gatherings, enjoy life together, you need to start protecting. You need to start conserving your hearing from now. So as such, at the tail end of your life, you can keep enjoying your hearing. So that's about that.
Thank you
I
very,
know, I know,
very
I know
much.
the responses are not exhaustive, but there's always time to talk more about these questions. You can reach out to me on any of my handles or always answer your question.
Hmm. Thank you so much, Mr. Promise. We can't
You're
thank you
welcome.
enough. Also, from what you said, I think I should show us how it's best to itch our ears when it's itching us without putting anything.
Okay.
You put your hand here,
At the
then you put
triangle.
pressure, you apply pressure.
Yeah.
Then when you apply pressure, it squeezes your ear such that the itchy sensation would leave. That's the best
Yeah.
thing to do. The truth is, some of us are addicted to putting feather, chicken
They will tell
feather in
you
our ear. That sensation is sweet, but it's dangerous.
it's dangerous. It's sweet, but it's dangerous.
Thank you so much, Mr. Promise. We've kept
And
you.
sorry, before you go, let me just drop this. If you have to clean your ears, just clean the outer part. This outer part that you can see. Just clean it with damp, wet cloth. But the inner part, I beg, leave it alone. Just let it be. Stop stressing it. Stop disturbing it. The wax in there is having a good purpose beyond what we can understand. A very good purpose. Because without the wax in there, most especially for children, before we go, children plays around a lot. They sleep on the floor. They can eat goody goody. They can eat granola. They can eat chewing gum. They can eat sweet. And before you know it, they sleep off. In such a case, for parents that do not understand the function of wax, every day you are poking your child's ear with Q-tips, cotton bud, and cleaning your child ear, you are exposing them. Because once they sleep on the floor, ants, cockroaches, I've seen cockroaches, I've seen bugs, I've seen ants in children's ear. They walk in easily. But if wax is there, the first thing the wax does is it repels them. It
Yes.
repels them. It's just like when a small pool of water is on the floor, no ant will go through that pool of water. It will go through the other way. The same thing wax. No wax can go into your child's ear once there is wax in there. But if it's so clean and neat, you would think, oh, I'm a very clean mother. My child is so clean. No, you are not clean. You are exposing your child's ear to infection. So ants can easily go in. So please stop poking cotton buds in your children's ear. And you're also teaching your children to use cotton bud. They see you using it. Tomorrow they will go and pick it where you kept it. They will also use it. In such doing, they will not be careful as you can be careful. They will poke their ears and you will spend money because they've caused trauma to the ear. So that's about that.
Thank you so much. Wow, I've really learned. I've learned a lot today, and we are very grateful. We cannot thank you enough for your time,
Okay.
your data, for everything put into this program today. Meanwhile, someone is asking a question related to barotrauma. That's
barotrauma.
The discomforts people have. Meanwhile, someone is asking a question related to the discomfort people have when they are on flights, when they are airborne. Please, can you touch a little? We know you are in Lagos and you have to head home soon because of traffic. But please.
Okay. Yeah, just like you said, we call that barotrauma. It's just simply changing pressure. You understand? If the person listening the other time, there is the pressure outside our ear, at the outer part of the ear and the inner ear, the pressure needs to be equal. The pressure needs to be equal. Now, if that pressure is not equal at any point in time, it will cause pain in that ear. And the pains comes from the eustachian tube. Also, the eustachian tube, if the eustachian tube is not functioning well, it will also cause you pain. So it could be, these two or more. Now, the pressure now, when you are moving up into the sky, the pressure in that level you are is different from the pressure in the next level. And you know that when plane is ascending or descending, they cut through different pressure levels. So once there is a cut through that different pressure levels, there will be a constant change in the pressure between the outer part and the inner part. So the eustachian tube needs to be quite functional at that point to, to regulate the pressure levels in both the inner and the outer part. So once there is a change in pressure level, you will experience that pain, and it's just for that moment. So in most cases, we advise people to simulate chewing, like you are chewing something or you chew gum in the stand. Once you're doing that, it helps the eustachian tube to open and close easily and adapt to the change in pressure. So basically, it's as a result of change in pressure that causes that. And if the eustachian tube is dysfunctional, the person will keep feeling that pain. So it's a temporary experience, though. It's a temporary experience.
Wow. Thank you very much. I think there are some questions in the comment section. In order not to keep you further, please, can you first attend to them on Facebook later in your free time? Just use the reply button to answer those questions. And also do the same for the YouTube, because some people are watching through YouTube. Just answer using the reply button.
No
Thank
problem.
you very much. Yeah, thank you. God bless you, Mr. Tony. Hopefully in the future, if people request to talk about hearing disorders again, we will call you again. Thank you, sir, and God bless you.
Thank you very much. Thank you for bringing me on your program. Thank you very much. Goodbye.
So thank you everyone for coming tonight. I hope you learned one or two things. I learned a lot, actually. And last week after our first lecture, I got a message from a pediatrician in India. Apparently, he has this platform he utilizes in reaching out to parents. It's called the Growth Book. The Growth Book, it's an application on Google. You parents can download it to track your child's growth and development. And the Growth Book wants me to do a lecture on speech and language development in children. So we have picked a date, and we picked 2 days so that we'll be able to do much. And the first date will be next week, Thursday. The flyers will be out during the course of the week, and we'll send you the link as usual. So please don't be selfish. Send these links to your friends, to your loved ones, to people you care about, to people who have children, not just people who have children with special needs. Parents of infants, parents of toddlers, parents of children generally need to hear these things we are talking about, so that they will be able to raise children. Some special needs cases are preventable, so that they will be able to prevent. Prevention, they say, is better than cure. So if you are yet to follow us on YouTube, please search for Speechy Heaven and follow us there on YouTube. Follow us, subscribe, click on the notification button just by the right bottom corner, and you'll be able to click on the bell there, so that whenever there's a video, there's anything dropping, or we are going live, you'll be able to receive notification, even if your friend forgets to send you a reminder, or if you forget, you'll be able to receive notification and you'll be able to watch later. Follow us on YouTube. If you use Twitter, follow us on Twitter at SpeechyH on Twitter. If you're on Instagram, follow me on Instagram at Mrs. P.O. Olaiya. If you're on Facebook, find me on Facebook. I remain Patience Oyeme Olaiya, your favorite speech therapist. Allow me to say that. Okay, thank you very much. We'll be responding to the other questions in the comments in the comments sections of the Facebook and the YouTube apps or handles rather. Thank you and bye for now.